In other news, the number of people taking their own lives in Japan rose for the first time in over a decade last year as the pandemic reversed years of progress combating a stubbornly high suicide rate. Japan's Health and Welfare Ministry said Friday that 20,919 people died by suicide in 2020, according to preliminary data, up 3.7% from the previous year. That compares with 3,460 deaths from coronavirus in the same period. It marks the first year-on-year rise in suicides in more than a decade, with women and children in particular taking their lives at higher rates. Japan has long had the highest suicide rate among the group of 7 advanced countries, though regionally South Korea registers higher figures. But the government has worked in recent years to better support people with mental health needs. Mental health experts around the world have warned that suicides could rise during the pandemic, driven by diverse factors, including economic hardship, stress, and family abuse. In Japan, the rise is the first since 2009 in the wake of the global economic crisis, but it follows a different pattern from previous years. Suicides among men actually fell slightly from 2019, but over 14% more suicides were recorded among women. While determining the causes of rising suicides is complicated, Michiko Ueda, an associate professor of political science at Waseda University in Tokyo, who studies suicide in Japan, said likely factors included increasing unemployment for women and extra burdens at home in a country where household responsibilities are often unevenly shared in families. The pandemic disproportionately hit industries that employed many women, often on temporary contracts, including hospitality and hotels.